Hello, Buffy Stinchfield, physical therapist with Pinnacle Women's Therapeutics. Today, I want to talk to you about incisions and scars and what we can do to help them heal. I do have a fair amount of friends, family, and clients that have had a cesarean section with the delivery of a child, one or more. And something that they're often not told about at all is how to care for that scar. Just recently, I was checking in with a friend that lives far away, and I said, "Hey, how are you doing after baby? And has anyone talked to you about doing any scar massage?" And she said, "Nope." And that actually is pretty typical. No one is doing a good follow up post surgery. So, here you go. If you had a cesarean, or any other incision for that matter, just know we've got a window of about 3 months time to make a really good impact on that scar tissue. Just realize when you've got something that's cut through, it's not just cutting through the top layer of tissue, it's cutting through all layers of tissue. And with the abdominal muscles, I think there's 8 layers in there that get cut. And so with the way that scar tissue is, it then binds all of the layers together in one. So just like, or unlike how with the back of your hand, if you play with your hand right now, you'll find that you can easily move the top layer of skin over the underlying surfaces or all the underlying layers of tissue, because we've got lots of layers. But when scar tissue forms, like I said, it binds them all together. This can create issues with these adhesions where things can get stuck. And after a cesarean, people will feel like they can't really move. They don't want to stretch that area. They're going to have to splint when they cough. They're going to be protecting it, and that doesn't help that scar long term. So yes, we need to protect it initially, but I will tell you that the time is when those scabs finally come off and it's just that new tissue. That is when it is green light to start doing some simple scar massage. And all that takes is maybe a little bit of vitamin E oil, your favorite lotion that you like, just whatever it is. It should allow your fingers to slip over it, not make it feel like you're getting a rug burn, and something that you know that your skin doesn't react to. So for a scar massage, all you need to do is take about 5 minutes a day, and just for a period of a few weeks to really get that scar moving and not stuck anymore. You're going to pretend like I've got a scar from here to here. I made some dots on it. You can just lightly, with a couple of fingers, lightly press and do some circles. And move on, press, do some circles. And you're gonna go as much as you're comfortable doing. That's the best part about doing it on your own, is you do as much as you can tolerate. When someone else is doing it, you're having to go, hey, more or less. But when you're doing it yourself, you immediately know if it's too hard or too soft. So you can do circles. You can go on either side of that scar and rub along it. You can also think of like train tracks. You can go over it like this, perpendicularly to the scar, whatever you're comfortable with. You're also going to get another benefit out of this, and that's going to be desensitizing that scar. Nerve endings get cut with any incision, and so naturally those nerve endings are going to be hypersensitive. So if you start rubbing it, even if sometimes there are people that they can't even let their clothes touch that cesarean scar for maybe 6 months. That can happen. So you can even start, if you're not ready for the massage, it feels too sensitive, take a tissue and just run it over that scar until that tissue no longer feels painful or uncomfortable. Then you can take just your fingers and lightly drag your fingers across, not even putting up any pressure indent in the tissue, just lightly rubbing over it, and then work your way into slowly doing massage so that that scar doesn't feel foreign to you. You get acquainted with that scar, you help it so that it actually can move and the top layers can move over the bottom or deeper layers and prevent long-term issues sometimes with adhesions from abdominal incisions. So I hope that that was helpful. If you are planning on having a C-section, now you're armed with that information. If you just did, you can work on it. Even if it's been more than that 3 months, you probably can make some impact on that scar tissue. And not to mention the desensitization, which can always happen. So I hope that helped. Thank you.